The most serious outbreak of Ebola virus in recorded history in Western Africa has also cautioned countries in other regions of the world. There have so far been more than 1,600 cases of Ebola, with around 900 reported deaths. Though the outbreak is still limited to countries Liberia, Sierra Leone, and Nigeria, countries across the world have started taking preventive measures. Meanwhile, many health clinics in Liberia's capital spontaneously closed down services after doctors said they were too afraid and not equipped to treat potential walk-in Ebola patients.
The health workers think that they are not protected. They don't have the requisite materials to use as to protect themselves against the Ebola diseases. So many of the health workers, including physician assistants, nurses, and so forth, are staying home.
India has maintained that it has no significant threat from the epidemic, but the health authorities are vigilant to the situation. On Tuesday, Union Minister for Health and Family Welfare Dr. Harshvardhan chaired a meeting of senior officers from different ministries to discuss a strategy to address the Ebola virus disease. The Airports Authority of India has instructed airports across the country to set up screening checkposts to monitor passengers coming from Western African countries. The directive has been issued in accordance with guidelines laid down by the World Health Organization to airports around the globe. The United States is screening its citizens who travel to West African nations where Ebola has been reported. However, the White House said there are no plans for the United States to ban incoming flights from the countries where the Ebola outbreak has occurred.
No, not at this point. At this point, there are screenings that are in place, both before individuals board flights in their home countries or where these flights originate, but also after these individuals arrive here in the United States, they are screened once again.
The symptoms of Ebola include fever and rash, bleeding and multi-system dysfunction. The disease spreads through close contact with an infected person and through body fluids like blood and urine. The Ebola disease has a mortality rate of up to 90% and has no specific treatment. Rohan Singh's report, DD News.